Here's comedian and magician, libertarian Penn Jillette. His show, Penn and Teller BS, is on Showtime tonight at 10 p.m. And the co-anchor of ABC's 2020, John Stossel. Don't miss his upcoming segment on Canada. Is it a special or segment?
A segment, unfortunately. Just a segment.
Just a segment. Well, you got the whole prime time. You carve out maybe a couple minutes for...
Anyway, we've talked about doing a whole show on BS on Canada, so be ready for that too.
Canada, I don't have a problem with Canada. Canada doesn't exist. What is that? Okay, so John, let me start with you. Let's start with Canada, the Canadian healthcare. I am so tired of hearing, because I grew up right across the border in Bellingham, Washington. I know the people. They build a special part of the hospital just for all the people coming in across the border to escape Canadian health care. Tell me what you found up in Canada.
What stuck most with me was the town that had a lottery. So many people are waiting to get a family doctor. They can't get one. Once a month, the town clerk pulls names out of a box and calls the lucky winners. Congratulations. Now you can have a family doctor.
Right. Penn, insurance really is, I think, the problem, because we have no restraint. We have no restraint whatsoever.
Well, you can also, if you have food insurance, there's nothing but gourmet shops. But what we have is not really insurance. What we have is prepaid, and that's a very big difference. If you had it so that people could get real, honest, catastrophic coverage, so they were really covered if they lost a lot of money, had a catastrophic event, but still had control over what they were paying on a smaller level, at least someone who was consuming the service would have some control over the payment. Well, it's when it gets really far away from individuals, it seems like a bad thing.
Well, I don't know, either one of you guys, if you've ever had this happen to you before, but I've sat in a doctor's office, and he'll say, what kind of insurance do you have? He'll be writing a prescription. What kind of insurance do you have? I'll say, whatever. And I'll tell you what, I'm going to give you this instead. They make different choices based on if somebody else is paying for it. And if you're insured and you're fully insured, you don't care.
As Penn said, as if you had grocery insurance, you wouldn't care in the grocery store. And the incentives that creates to spend more are just insane. And that's the problem with health care. And yet the politicians say the solution is always more insurance.
Right. And I think, I don't know about you guys, I'm sure, because once again, there are put all three of us up. There are 3 libertarians on television at once. It's like this is their convention right now. When we talk about...
Where's Andrew Napolitano?
I know, he's upstairs, he's watching going, oh, this is erotic. The thing about, the other argument that people always have is, well, then what are you going to do to fix it? What are you going to do to fix it? First of all, I put people in charge of their own medical care. And then I also cap the attorneys, because the other reason why nobody seems to care, the doctor is under so much pressure to not get sued that he'll do absolutely every test, because he doesn't want somebody to say, well, why didn't you do that test?
It's safer to do 1,000 tests and somebody else is paying, so they do many more. I don't know that capping is all that fair or that libertarian. If somebody behaves truly egregiously, maybe a trial lawyer should punish the heck out of him.
Well, okay.
How about loser pays?
Absolutely. Okay. How about that?
Reduce the number of suits.
Right. If the person that comes and brings this ridiculous lawsuit loses, they pay for it, I'm all for it.
And then the parasite class can't just go suing everybody for bad reasons, and when they're proven wrong, they don't even have to say they're sorry.
So, Penn, how would you fix health care?
Well, one of the things is there's all this pretending that we're going towards socialized medicine. We're not going towards it. We're already there. And one of the problems is that people are pretty happy with Medicaid and Medicare, and I'm not. I think that morally, philosophically, individuals having more choice and more control over what they do is a really good thing. So I'm afraid that I'm in the really nut position. I would like to get insurance away from the employers. I don't know why your boss has to be in charge of your insurance. It should be the individuals who travel with them. And that was only put in, as I understand it, during World War II. It was a workaround on wage freezes to be able to give people more stuff. Stop the employer from being in charge of that and make it individuals. Your employer is not in charge of what you eat, and eating is as important as medical care.
Right. Here's the deal. In New York, because I'm a small business owner and I have 20 employees, I can't go out and buy be part of a plan in the entire country. I can't get a big group plan, but the government can. But they restrict insurance companies from putting a big, huge group in. So it's costing me an arm and a leg, and it's worse in New York than I bet any place else.
And it's illegal for you to buy a policy in New Jersey, say, where they may have fewer stupid rules.
Right.
So your policy costs more.
Exactly right. By the way, I want to show you a little bit of John Stossel's upcoming segment on healthcare in Canada and Great Britain. Watch this.
You want innovation and fast treatment? That often comes from people pursuing profit.
And you see that in Canada, because even here, there is one area where they do offer easy access to cutting-edge technology.
CT scan, endoscopy, thoracoscopy, laparoscopy, arthroscopic procedures to evaluate joints for cartilage abnormality.
Available all the time.
24 hours, 7 days a week.
Patients rarely wait.
If I see a patient that's torn a cruciate ligament in that patient's knee, we can generally have that patient scheduled within probably a week.
But you have to bark or meow to get that kind of treatment. Want a CT scan in Canada? Private vet clinics say they can get a dog in the next day. For people, the waiting list is a month.
Unbelievable. It's absolutely unbelievable. Let me ask you both this question. And Penn, you said a minute ago that healthcare went to the employers back in the 1940s. I went back and I played on the radio show today a fireside chat by FDR where he talked about the Second Bill of Rights. Are you guys familiar with his Second Bill of Rights? Yeah, I'm going to play it on television because there's video of it as well. It's practically been erased from our history books. He talked about there was a right to a job, and he actually wanted to put this into the Constitution: right to a job, a right to a house, and a right to health care. It was rejected, but if you look at things, he did put the beginnings of health care. He did put the beginnings of you're never going to have to worry about it with Social Security. He did put the beginnings of a right to a house. Right now, about 60% of houses are owned by Freddie and Fannie. And what does Obama do? He says, by the way, we'll just buy your house. If you're going to collapse, we'll just buy it. And then you can rent from us. My gosh, our country is being transformed into something that is nothing like what our founding fathers laid out. True or false?
Certainly going in that direction. I think today that platform would win. It sounds good. Yeah, I have a right to a house. I have a right to health care. It's a rich country.
You don't
Sounds
work
good
for
to people.
it.
Well, we have to explain that to people, that if you want good houses and good health care, all the innovation comes from that evil capitalism.
I know. Okay, go ahead, real quick.
I was just going to say, but you always talk about the ambitious people and the ones who want to work hard. You should also stick up for the lazy people. Capitalism allows people to do just enough to get by and not have the government tell them what to do.
Let me tell you something.
And that's also a reasonable life choice.
It is. I have absolutely no problem. There are people...
And capitalism allows that.
You know that there are more beds in New York City than there are homeless people. There are more beds in homeless places in New York City. True or false, John Stossel?
I have no idea.
Okay. Come on, you're like Mr.
I don't know everything.
Okay, so they have more beds. The city actually hires people to go out, and a lot of times they know these guys by name, and they say, please come into a shelter. They choose not to. That's fine. In America, you should be able to do that. But why is it that we have this nanny state? And again, it comes back from the progressive movement in the early 20th century, where they talked about I think it was H.G. Wells, who was a big progressive, said the state has a right to humanely put you down if you refuse to work or to conform to society. This is craziness.